Hello and welcome to Challenge channel. This is gonna be the first lecture in physiology, and we're gonna start with the most important topic in physiology, which is the CBC. CBC actually stands for complete blood count. The other name for CBC is FBC, which is a full blood count. CBC play an important role in diagnosis a lot of diseases, even cancer. I mean by that, just by CBC, we can suspect cancer according to the result of CBC. The question is, how treat the CBC very rapidly in just few seconds and with high accuracy? The answer is that you don't need to read all of the CBC numbers and figures. We just need three numbers, which are WBC's count, RBC's count, and platelet counts. As I mentioned, the most important things or figures in CBC are WBC's, RBC's, and platelets counts. We mean by RBC's count the hemoglobin concentration. If these figures are low, we should suspect a problem in bone marrow, which is the area of synthesis of these cells. Also, patients with massive splenomegaly, I mean by splenomegaly, large spleen. So, this patient with a very large spleen, the number of platelet and other CBC figures will be low. And if these figures are very high, we should suspect malignancy or cancer. So, let's start with platelet. The normal range of these cells is 150,000 to 450,000. You need to remember this number. If this number is below 150,000, this means there is a problem in the bone marrow, i.e. bone marrow inhibition. So you should put in the back of your mind, if you find this number is low, you should refer the patient immediately to hematologist, because this patient may have a problem in the bone marrow. And if you find this number is high, I mean by high above 450,000, you should suspect malignancy. But before you say to the patient you have a cancer or malignancy, you should ask him, did you remove your spleen? If the answer to this question is yes, that means this patient does not have a cancer. And if answer of this question is no, that means this patient has a cancer or malignancy. And in this case, you should refer this patient to hematologist. So why does the patient with removal of spleen or splenectomy has a high number of platelets? The answer, because the spleen is the area of destruction of these cells. So if the patient has no spleen, the number of these cells will be high. To sum up, the normal platelet count is 150,000 to 450,000. You need to refer the patient to hematologist in two situations. The first one, if the patient has low platelets count, and the second one, if the patient has a very high platelet count and patient had no history of splenectomy or removal of spleen. In the next video, we're gonna discuss two important CBC figures, which are RBC's count and WBC's count. That's it for today's lesson. If you have any questions, please let me know. Thanks for watching. Don't forget to like this video and subscribe to our channel in order to get more and more free videos on the time of production.